Thank you for joining us for this conversation, Dr. Irene Weru. It's a pleasure to host you, and it's a pleasure to learn from your journey and the work that you're doing in the pharmacy area and also in terms of supporting young pharmacies in different spaces so that we advance access to healthcare services. So as the head of clinical pharmacy, maybe you just introduce yourself and talk us around what you do in that particular line of work. Over to you.
All right. Thanks, David, for having me here. I know it's been a long time coming. As head of clinical pharmacy at KNH, I'm basically responsible for practice, supervising the work that is done by our pharmacists in the different pharmacies, as well as those that work in the clinical spaces in the ward rounds. I'm also secretary to the Medicines and Therapeutics Committee at KNH, using my clinical pharmacy training to basically look at multidisciplinary activities within the hospital, especially that relate to medicines and therapeutics, availability of products, protocol development, etc. So that's basically what I do on a day-to-day basis. Yeah.
Okay. Thank you for that. And how is the experience? Is it a fulfilling experience based on your personal interests, and how does that work for you?
It's a fulfilling experience. Leadership is interesting. Interesting in the sense that different people that you're leading or interacting with or expect to contribute to the agenda that you have on the table will have their own perspectives. They will deliver differently. So leadership is a bit interesting, but I think I can say that I am fulfilled. But I think my most fulfilling days have been by the bedside, working with patients on a day-to-day basis, talking to them about their medication. I find that working directly with patients is a lot more fulfilling for me, I think, because they are anxious to get benefit from what you're there to provide. But leadership is interesting, and I'm learning every day. Yeah.
Great. Thank you so much for that. So loving your love for the bedside care and offer now being in leadership and supporting others to actually offer that bedside care is a critical contribution. And also one of the key bits that I just noted is that you served at one particular moment as the head of the pharmaceutical products department. And based on your clinical pharmacy training, how is that kind of transition, and what skills do you bring into the supply chain management of pharmaceuticals? And what are the unique intricacies that you'd want to share with us of that?
All right, that was interesting. So last about 10 months, from sometime in June 2022 to April this year, there was a bit of tour of duty, sort of realignment, reorganization in the pharmacy division within KNH, and I had the opportunity to work in supply chain. So what was interesting is that as clinical pharmacists, we a lot of times will think that supply chain is maybe boring, or we don't want to deal with the product, we want to deal with the patient. But what I can say is that as I served as head of pharmaceutical products, I actually realized that you can bring your clinical knowledge and skills to supply chain in terms of selection of the products, describing the product correctly, working with the supply chain division or department and the officers to describe to them consumption data, explaining to them why some products would need to be dispensed in certain quantities or to be ordered in certain quantities. I think that was interesting, and it helped that I am a clinical pharmacist. So there are items that I would be able also to tell them, we can provide this as an alternative to these other products. Or maybe you have one product that is slow moving and yet you have an out of stock in another product that could do exactly the same thing. So I think we can use our clinical pharmacy knowledge to actually support the supply chain colleagues to serve us better in terms of availability of supplies, in terms of describing products properly. So a lot of times the suppliers officers doing procurement would call in and say, okay, we have this, is this exactly what you're looking for? And sometimes you'd realize that whatever you had described the product is actually, it either has an error, that's why you're not getting successful bids, or you would find that maybe that you can change a little bit because maybe it's the strength in the market that's different, or it's the salt that is different. If you think about it positively, actually, even a clinical pharmacist can serve very well in supply chain. Yeah.
Oh, okay. Thank you. So I think to a greater extent, the reason as why that is of interesting bit is there's that kind of disconnect between the supply and the distribution. And working in the pharmaceutical industry, actually, the reason as to why I'd be keen also to look at that possibility is how do we, as let's say, for example, from the pharma industry, collaborate with you as a clinical pharmacist and the clinical teams to ensure that the products that are in the market are actually informing your own inventory. And that would be a critical conversation that also could be keen, and probably that is a collaborative area that would be interesting. But thank you for sharing that. So the other bit that I would just want to add to it is the fact that you in pharmacy, you've excelled in it and you've impacted lives as much as possible, and you're still growing in your career as you keep impacting people into the leadership positions. How did you make your decision to get into pharmacy?
Wow, that's interesting. And every time I hear that question, I'm like, I could have been anything I wanted to be from high school. I loved numbers. Mathematics was my best subject. And then when I got to high school, chemistry became another very interesting subject. So I loved math and I loved chemistry. So in high school, I had a chemistry teacher who was really motherly, caring, encouraged us to do chemistry. And I actually recently realized that there was once I scored 105 in chemistry, which was really interesting. And I think that is one of the things that spurred me to want to do something related to chemistry. But around the time when we needed to select courses for university, I had my mom get relatives and family friends speak to me about different career paths. So I spoke to engineers, I spoke to accountants. I never really got to speak to a doctor or a pharmacist, but I had one uncle who was an accountant. And he actually discouraged me from doing accounting, maybe because of how I described what I wanted my work life to look like. And he's actually the one who explained to me the different medical courses. At the time, he worked at the University of Nairobi, and he explained to me the different courses. And I thought to myself, wow, I could do a health course, but I don't want to do something related to people and blood directly. So that's how somehow I settled on pharmacy. So pharmacy, in his explanation, would provide me a blend in working with numbers and working with chemistry. So I don't know whether that was a good choice at the time, but I think that's really what encouraged me to go into pharmacy. Yeah.
So then you ended up in clinical pharmacy. So you are still by the bedside with the patients.
Oh, now that's a whole different story. In university, actually, clinical pharmacy was my weakest. Why? Because I am probably a very empathetic person or very emotional person. So those ward rounds were really, really difficult for me. I'd walk into a ward round and I would just suddenly feel pain. And I would walk to the back to sort of get fresh air, but still not miss the lessons. But when I completed university and did my internship, I actually found that it was going to be very difficult for me to work in the industry because the industry setting in Kenya was not that exciting for me. And I found there were other challenges. I had to sort of take the tours to industrial area every morning. So that was my experience during internship. When I went into retail, I found that the community is truly biased. They would come in and they would be like, oh, we would want to speak to the pharmacist. And they would be told by the pharmacy assistant, you will wait a little, she's speaking to someone else. And then they would look at me like suspiciously. I had a few people ask, did you really study pharmacy? And I said to myself, I will not do community pharmacy. I can't keep explaining that I am the pharmacist to the community. When I did hospital rotation at Kenyatta Hospital for my internship, I realized that in the hospital, you can do many things. you can serve the patient and not necessarily by the bedside. You can serve the patient and still be at the pharmacy. So somehow from the 3 different internship rotations provided for a pharmacist in Kenya, I thought hospital would fit best for me. And so that's how I ended up in hospital. And then, of course, while working at the hospital, there was now time to grow and take a master's program. And because I was already in the hospital and working alongside the other healthcare workers in the hospital, I was like, okay, fine, then let me just take a master's in clinical pharmacy. So I was actually in the 2nd cohort at the University of Nairobi when the master's in clinical pharmacy started. Yeah.
So with the master's in clinical pharmacy at the University of Nairobi, one of the questions is, you mentioned that actually the hospital supported you in the scholarship and funding of your education. Are such opportunities still available for the young pharmacists who are working in such spaces and even in other facilities?
Kenyatta National Hospital has been truly supportive. So every year at the hospital, there's a budget specific for training, and every area, whether clinical or non-clinical, prioritizes their training needs. And based on your training needs, then different staff will also say what training courses they would want to take up. And there's usually a training and research committee or just a training committee within the department that will decide what are the priority courses. And then given the budget that's available and approved by the hospital, then we are still able to release the younger colleagues, whether pharmacists or pharmaceutical technologists, to take up courses that are aligned to the hospital objectives and to the strategic plan of the hospital. Yeah.
Oh, okay. So it has to be linked to value that the hospital expects out of them, and definitely now with the interest of the person.
Yes, yeah, yes, definitely.
Perfect. Thank you for that. So based on those advices that you got from your uncle who got you to pursue pharmacy, and now you love pharmacy, what do you believe is your role and the role of the society generally in guiding young people in choosing their career paths? Especially that school and they don't have an idea of where they want to go.
All right, so basically being available to provide career guidance for the younger people in schools or right out of school, but also in terms of providing opportunity for young people to learn about different careers from different people, whether it's your neighbor. I'm so sorry about that. I hope the internet holds. All right, so saying that we can mentor young people and we can explain to them the different careers that are available. So many years ago, we had this end of year party, and around the table, all the parents explained what it is they were doing. And I remember my 5-6-year-old picking something from one of the parents. So as we drove down Mombasa Road on a different date, he saw something about marketing on a billboard, and he said, "Is that the kind of work so-and-so's mom does?" And I was like, okay, this is interesting, because the children listen and they pick from it. So picking from that, I think those are examples of how within your community, you can have different people explain to young people the different careers available, explain to them what the careers are. And whenever possible, maybe have bring your child to work days, or have different professionals going to the workspaces, to the school spaces, to actually explain to students whatever it is they do. I know now with the new curriculum in Kenya, the competency-based curriculum, they have that opportunity for different professionals to go to school and speak to students about their careers. So I think that's one channel where we can provide that opportunity to teach different people about different careers. Then whatever choice they pick, at least it is a choice that is informed. It is not guesswork. It's actually something they have thought through, they have had somebody else, they can relate a profession to somebody that they know. Yes.
It's not because some of us, that is what we do. Yeah. Because I wanted to do medicine, then I went choosing and I missed one point to get medicine. Then the next medical course is pharmacy. Then I found myself there. And also there's one thing that you mentioned around those career days. And they're very, very important because at that point when I transitioned into campus, when I started my first year, I was kind of still conflicted and exploring opportunities to transition and everything. And we had our first career induction day. Actually, it was facilitated by Dr. Patricia Nyokabi. She was still in JKUAT and as the head of the student association. Luckily enough, from that experience and knowing the different possibilities in pharmacy, I fell in love with pharmacy. And I think it's been the best. So thank you for sharing that. And the other bit that you mentioned around education and exposing people to these possibilities, at a personal level, you talk about the work you do as former member of PTA, Parent Teachers Associations, and also as a Sunday school teacher. What is the motivation behind doing all that in academia at a personal level?
All right. So at a personal level, I love to work with the young people. It's been about 3 years since I last stepped in a Sunday school class, but I enjoyed teaching Sunday school because children are ready to learn and to grow and to be molded. And for me, that truly touches my heart to just be available for them and to teach them. But then for the longest time also, I was part of a Parents Teachers Association as a member, active in a committee, and for a couple of years, about 4 years, I chaired a PTA where my children went to school. So for me, it was about being available for the children, motivating them, inspiring them to do their best, inspiring them to identify their gifts at an early age, so that they can be the best that God intended for them to be, really. So it's just something that's really close to my heart, and not just for those young people. I think it's the same love for the young people and to inspire them that I carry even into my workspace, trying to inspire the pharmacists and the students that come to our spaces to want to be the very best that they can be, and to be available for them as a role model, that whatever it is I'm doing, they can see, they can relate to this person who's here, who's loving on us, and who's trying to be the best that they can be, and they will want to actually emulate it. So that's really at a personal level what I can say about my love for just inspiring the young people. Yeah.
I'm one of the beneficiaries. And I remember recently when I was doing the McKinsey Forward program, I was reading about the model of change and the fact that at times you get to know about things, but you don't know how to go about it. All of us might say we know what clinical pharmacy entails from the literature. When you actually see somebody doing it, you want to be like that person, you're inspired by them, and you look forward to being like them. Then it's now a model, you have a path to follow, and you're doing a good job at that, and I'm hoping you keep at it. And most of us learn from you and get better at it along the journey. So thank you so much for sharing.
You.
On the same line, in terms of the kind of mentorship and the kind of work that you're doing in your personal career, in your personal journey, one thing that I would want to ask is, I actually have 2 questions as a follow-up to that. But the first one is, being the best of you, what does it mean to be the best version of you at a personal level in terms of your career, your personal lives? That would be one thing. And then the other bit is around mentorships and working with people in different environments and mentorship. How has mentorship contributed to the person that Irene Weru is today?
Wow. From the first question, for me, when I wake up in the morning, I ask myself, how can I contribute positively to my workplace, especially because we spend a lot of time at work. We are there 5 days a week at least, at a minimum, 8 hours a day. So to ask myself, have I done my best? what could I have done differently? And it's interesting because I actually reflect on my day every evening. In the morning, I set out to do my best. And in the evening, before I sleep, I actually look back to the day and I ask myself, what could I have done differently? And what could I have done differently, even in interactions with people, in my speech? Because there are days you will have a bad day, you will interact with people, you will hurt people, you will be hurt yourself. So really, just reflecting on how each day is and wanting to do better the following day. Looking at the work that I have every morning and setting out to do it, completing it, prioritizing, and at the end of the day, looking at, is there any way I could have improved? So the other thing is my belief and my trust in God, and knowing that any day I serve, I am not serving only the human being. I am a vessel through which God touches lives. So when I set out to work, besides my reflections at the end of the day, just in the humanly way that I know how to, believing that my service is unto God, who gives us the knowledge and who blesses us with the gifts that we have and the ability that we have to actually serve the communities that he places us in. So for me, that's truly important, and it is what keeps me going. So that even when I am given an unpleasant task to do, I will speak about it, yes. I will let my supervisors know I don't have the capability, I feel inadequate, but I will always ask myself, this task, there must be a reason why it is me that's been identified for this task. And I will do it to the very best. The role of mentorship from others, I interacted with people from different spaces. So for example, when I set out to do clinical pharmacy in KNH, there were not many oncologists. There were barely any oncology pharmacists, to put it that way. But I worked with oncologists in practice, and many of our oncologists at the time had been trained outside the country. So they had experience working with pharmacists. They had experience seeing what a pharmacist can bring to the table and contribute. So I sat at their feet and learned from them. And I was willing to learn from them. At a regional and a global place, I am a member of the International Society of Oncology Pharmacy Practitioners, current secretary. And I have friends and colleagues from around the world who I can reach out to with questions, with queries in terms of practice, and I will have guidance, and I will be able to do better. And many of them have actually inspired me to want to continue working in the oncology pharmacy space and to do what I am doing and be able to challenge and grow other people along the way. So some of those are not formal mentorship engagements, but definitely they are there, informal, many of them informal, but always willing to learn from other people and being available for them. And I found that there are a lot of people who are willing to teach and to grow others, and they are really available to grow others. So that has really impacted on my life and helped me to be a better version of myself at my workspace. Yep.
That is a critical bit, in the sense that you have people you can reach out to when you need that guidance. That is very, very important. And I'm hoping as young people will take that opportunity, because I feel like there's that kind of gap where somebody is willing to offer the insights and share the learnings, but unless I ask for that guidance from you, you will not be able to, because you don't even know what I need. But at a personal level, I know what I need. Yeah. So that kind of being able to reach out is a good bit. So thank you for that. And then in the first response, actually, you talked around the value system and believing in God and all the work that you're doing with the best version of yourself, and to see yourself as a vessel that is doing God's work in this world and making a difference on that. And some of the other key bits that you talked about is how being dependable is critical for you, the willingness to learn, and speaking up when you're not able to do one of the things that you need to do. So these are some of the things that you believe in. how do you believe that, how have they contributed to the person you are? But also, how do we build a positive work ethic among young people? Because that is another critical thing, the conversation that we need to be having as individuals, to be dependable people who are counted on delivering on their work.
All right, so I know earlier on, we've basically discussed this earlier on in this conversation, where people learn by seeing, yes? So when I talk about people being available and dependable, I believe in being the example, in being available and dependable. So a simple example is in our workspaces. As a supervisor, I do not expect my staff to be there 40 hours a week like is expected of us, or to be there 8 in the morning and stay throughout the workday if I am not that example. So for me, I really believe in being the example for being at my work when I am expected to be at work, so that my supervisor knows that if they've given me a task, or if I'm expected to be in a ward round, I'm expected to be in a meeting, I am expected to do a certain activity, that I will do it without their supervision. So I believe in being an example so that the others can emulate what I am and that positive work culture. It's interesting that you talk about work culture, because I know right now in government and in many ways, in many places, there's a lot of talk about culture change. So if we are hoping for culture change, it starts with us as individuals. So I cannot talk about culture change in the workplace if myself, my attitude is not in the right place, and I am not an example for others to emulate. So for me, even when the students and the interns come to us, I will tell them in my workspace, these are the working hours. I will lay out the expectations. I will tell them about the expectations. I will also let them know when I will be in the, if we're talking about a teaching session, I will let them know I am not available for a teaching session at this time. I will be accountable to them in the sense that I don't want them to think when I am not at my desk, I have not arrived at work. So when I have a meeting in the morning, and in my hospital meetings are usually early in the morning, I will let them know, so that they begin to see that you need to talk to your workmates. You need to explain to your workmates where you're at. Your workmates need to know that today you have a meeting 7 to 9. You cannot be working in a mysterious fashion. You need to work in a way that at least people know where you are, what you're working on, so that everybody is on the same page, really. Yeah.
That's what you just mentioned in terms of communication aspect. Because to a great extent, you'd find some of the culture gaps that we're seeing is because I come to the facility and you're not there in the morning, and I'm like, oh, Dr. Weru will never be here by 9, so I can come at 9, not knowing that you're already in the facility by 7, attending other meetings, which are actually contributing to the work that we need to be doing. So with that kind of communication, people believe that everybody's holding the end of the bargain. And I think to a greater extent, even in some of the conversations we've been having, is we need to see how to foster accountability, because unless we foster accountability at a personal level to the organizations and to the nation as we are, and also to God in terms of our contribution, then we are not delivering up to our optimum. And if we don't deliver on our optimum, efficiency gains are not there, and we're failing ourselves and the society at large. So that is a critical bit.
Yeah.
In terms of the work that you do, International Society of Oncologists, practitioners and pharmacists, one of the key bits that I would want to understand is, how did you get yourself in such a platform? And what are the contribution of that platform to you? And for a young pharmacist who would be looking at, how do I become a member? How do I get to engage with people in that space? How does that happen?
All right. So after my master's in clinical pharmacy, I decided to look out and see how can I grow in the area that I have chosen. I had a colleague who would attend these meetings internationally. She switched from pharmacy at some point and decided to move into a different line, but would attend these international meetings and should come back and say, I learned this, I learned the other. So after my master's in clinical pharmacy, I decided I really needed to plug in more in what was available to grow. Because if you can't work in a silo, and if you decide to keep to yourself, you will never really grow. So I attended my first meeting of the International Society of Oncology Pharmacy Practitioners in Prague, Czech Republic in the year 2010. And when I attended that meeting, I realized there was so much to learn, and the people were so willing to support and to have you join them. So from that first meeting, I decided to join in. I joined the organization. I decided to be more active, joined different committees, and slowly I was able to engage more. In 2019, we were able to hold an African regional meeting in Nairobi, and we had pharmacists from different countries, basically people in the oncology space, nurses, a few of them, and some medical doctors, a few joining us in Nairobi for that meeting. So for me, I can say, from that meeting, actually, so many pharmacists within the African region were so inspired to plug in and want to learn more. And I think that really just began sort of a movement that is basically growing, and people are connected and talking to each other. I know we have a WhatsApp group that has lots of pharmacists from across Africa that are talking to each other and learning from each other. So from that time when I joined ISOP, I just decided to be active. I have been active, and of course, when there were positions, I decided to vie for a position, and I've been secretary now. This is my third year secretary. And it's been an exciting journey because, one, it challenges me to want to do better because there's a whole community of pharmacists looking up to me and wanting to get involved because they've seen me involved and they are challenged to get involved. So, and then I have all these colleagues, like I said earlier, who will challenge you. There are learning opportunities, there are opportunities whether in conferences or in short courses. And I think there are other associations, of course, around the continent. If you're a pharmacist, for example, interested in pharmacovigilance, there's the ISOP with a single P, and there are some who are there. There's ISPOR, and there are many other associations around that we can join in. Locally in Kenya, there's the Hospital Pharmacists Association. There's the Pharmaceutical Society of Kenya. There are many opportunities for you to get involved, and many others for the industrial pharmacies, for those in regulation, etc. So find yourself a space and plug in. And when you plug in, get involved. So when you get involved, there's commitment. You own whatever it is you're involved in. Because when you're not involved and you're passive, you will always be criticizing what the other people are doing. But when you get involved, the ideas that you have can also be incorporated in the growth of the organization you're part of.
Thank you for that bit. In the aspect of commitment and actually being involved in the running of the association and the platform that you're part of. Because I've realized over the last couple of months or thereabout, we have this kind of aversion in the sense that we point fingers at leaders who are in these helm of these associations, but at the same time, we are not giving them the support they need. We are not contributing and giving divergent ideas or alternative approaches to addressing issues. But unless we tell them they're not gods to see what we want at a personal level, so how do they then implement what they don't know? I think that is a very critical bit. Most of us, it's a learning opportunity that we plug in, get into the platforms, and make your contribution, because it's by doing that is how you grow yourself as well. So thank you for that. So as we move towards the end of it in terms of the kind of trends and all that, the question is, what trends are you observing and how do we take advantage of those emerging trends as pharmacists?
All right, thank you. So I'll talk about trends in my area, really, not broadly in pharmacy. So in clinical pharmacy, for example, some of the trends I've seen is research is really a growing area. There is a lot of opportunity for clinical trials. We have clinical trial centers setting up locally. We have one at Aga Khan. We have one at the International Cancer Institute in Eldoret. We have the United KNH Clinical Trial Center, and KU also are setting up something. So clinical trials is going to be one great opportunity for pharmacists to plug in and contribute. And we might actually just have that as an opening for pharmacists to just participate full-time in these clinical trials. And other areas of research. There's operations research. There are so many questions we ask every day, and we need people to contribute by conducting this research and contributing to the pot of knowledge that we have. The other area is in collaborative practice. We have a lot more of our physicians and specialists in different areas understanding the value of the pharmacist. And so there's opportunity for collaborative practice, whether in the private setting or in the public setting, where you work as specialist teams. So I'll give you an example in oncology. We at KNH right now, we now are setting up the specialization groups. For example, we have a breast cancer group, we have a colorectal and GI cancer group. Those are some of the things we are setting up. So there's opportunity for pharmacists to plug in into their special interest areas. So we are few at the moment, so you might find somebody doubling up in different areas. But with time, as the numbers grow and as the organizations, institutions employ more pharmacists, we can actually sub-specialize, super specialize, let's put it that way, in different interest areas. So that's something that I see as an area where we can plug in right now as pharmacists and grow. There are many other areas, but I will for now just focus on those two and just leave it at that. Yeah.
So for this particular area that you've mentioned, research, collaborative practice, and all that much of it, how do we as young pharmacists get into the spaces? Because the other bit is we see those opportunities are available. They're talking about how the trends are going. So how do me as David come from my undergraduate internship experience and say, now I'm going into clinical trials. How can I get to learn and how can I plug into such a platform?
All right. So for clinical trials, for example, you need to have your GCP certificate, your good clinical practice. And those are many available online. You renew, like, depending on the certificate that you take, you will renew it. And then find these clinical trials when they are advertised, even if you will initially start by volunteering. If they don't have a job opening, you can start by volunteering and showing your interest in that area and working under the pharmacist who's the clinical trials pharmacist, for example. But you have to bring yourself to the table, isn't it? Come with the paper that is required. Don't wait to be called, because I think there's a lot of unemployment right now. And so it is, you get the opportunities by availing yourself to where those opportunities are. I don't know whether to say you need to be aggressive, but sometimes when you don't know how to, when the jobs are not coming to you, you need to take yourself to those jobs, isn't it? Volunteer if you can, and sometimes you volunteer for a season. And the challenge also is for those who are in those spaces already to be willing to take up the young pharmacists, like you're asking, to be willing to take them up and let them learn. The other challenge is this pharmacist who's taking up a younger pharmacist. If you don't have a budget line, you can just buy them lunch and give them fare. They will come, they will support you, and slowly they will gain the skills that are required. It is better than them staying at home and not growing in their skills, isn't it?
Yeah, thank you for that. And that aspect on aggression and everything, some people would be kind of reserved around it. You have to be proactive generally. And especially with unemployment, some of the key things that I'm saying is, let's say, for example, one opportunity opens up for us as young pharmacists. If somebody is coming with a GCP certification already and somebody doesn't have it, definitely the clinical trial principal investigator will take up the person with the certification. because it eases the
Yes.
process and actually expedites the whole process of getting approvals and getting the site running. So those are some of the aspects that you have to be proactive, which is critical. Another thing that I just realized as well recently when I was at the Pharmacy and Poisons Board, that as pharmacists, we can't be principal investigators. We don't need a physician or a nurse or any other professional to take lead in a clinical trial. So it means even for pharmacists who are looking at setting up clinical trials, you can start off as the principal investigator, look for trials that are going to be coming into the country, and they execute on them. And that is something that we can explore as we move along. So thank you for sharing that.
Exactly.
So, yeah. In terms of the other thing that I'm just keen to understand from you, you talked about how you have a supportive family, and the aspect of family is a critical bit, especially in our setting. We are social beings. We depend on families for support and the communities where we exist to be the better people. So for you having a supportive family, how did you get to that? And what are the lessons that we can learn from your family life and with your sons?
All right, so my family, I'll speak about it even from the extended family space, yeah? That, like I said before about being accountable, my family knows what it is I am up to. They know this is where I am at, this is what I'm up to, and I speak out when I need the help. You know, sometimes we want to be so secretive, maybe because of our culture as Africans. You think that if your family knows what you're doing, some of them will throw in something and you will not succeed as you were hoping to succeed. But I come from a family where my mom and my siblings, we speak about what it is we are doing, and you speak about the help you need. And from that, then people know where to support you. And if they are not able to support you, then they will tell you, we are not able to support you, and give you the ideas that will help you. My family right now, I'm married and I have 2 sons. So we speak about what it is we're doing. I am accountable to my husband. I will let him know what I'm doing. He will let me know what he's doing. And I will say, this is the help I need. This week I am not available. I need to travel. And so when you talk about what it is you're doing and how the support, and what support you need, then the family is able to step in and support you. I know different families have different ways of working around it, but my challenge is, as families try and work together, grow each other. I am truly, truly blessed to have a supportive husband who allows me to do the work that I do at my workplace at Kenyatta. When I need to be there early for a meeting, or I need to work late, or I need to travel, he's supportive. And so for me, that's a blessing. And the challenge is for others out there to try and work together, support each other. It's not a competition. Yes, it's not a competition. It is, we are working together to support each other and to help one another to be the best that we can be. So for me, the challenge is for others to just work together as teams, support each other, grow together. So that's what really I can say in a nutshell. Yeah.
Thank you. It's collaboration, not competition. I think this
Thank
aspect
you.
of collaboration is important for most of us to understand. So
yes,
as we come to the end, actually, I have 2 questions for you. What are the next steps for Dr. Weru? What are you looking at in the future? Yeah.
All right. So what I can say, So what I can say is that I am looking at the number of years I have at Kenyatta Hospital are fewer than the years I've been there. So I'm looking at, so moving forward into the future, what it is I can get myself into. I'm hoping that I can get into more research, for example. So I hope that I can sort of grow myself as a researcher and work with others to get into research. So that is something I'm looking out for. And also look for other opportunities, whether they are consultancy jobs or whether they are teaching jobs, just different things that I can do outside of my work whenever that is possible. so that I am able to grow myself and position myself for the years beyond formal employment. Yeah.
That is a critical bit, especially in terms of planning what the future looks like and also knowing where you're heading, because most of us, we just go by, it's like rite of passage. I finish school, I go for internship. After internship, I'm looking for a job. Then it's a journey, just move with it as it is. So having that plan is a good part to start from. See how we could engage and learn from you as well. And my last bit is, as you're going into that, you also talked about your work in accounting and having interest in numbers. Have you considered doing pharmaceutical accounting as a career?
I actually did consider doing some accounting issues, but not as pharmaceutical accounting, but in terms of pharmacy benefits management. I actually took one of those self-paced online courses on pharmacy benefits management. So I've done an online short course on pharmacy benefits management that has a lot to do with numbers and working around numbers. So, and I use numbers also in my everyday work. So I haven't quite decided to do pharmaceutical accounting as such, but using numbers in other areas of pharmacy and healthcare space. Yeah.
And that's an interesting view that you've mentioned, the pharmacy benefits manager, because I remember the last reforms with NHIL, there was the consideration of having a pharmacy benefits management institution that is going to be set up, the dynamics around it. So having you with that kind of understanding and the basic experience in the industry, that could help us inform those conversations as we move along. So thank you so much for that. So as Dr. Weru, what is success to you?
Wow, so success to me is being able to grow others, to go further than I have gone myself. So when I look at where I am today, I ask myself, what is it? What is my legacy? And can I say that I have grown other people to be better than me? And to go further than I have gone. If God were to take me home today, then the question I would be asking on the day I am negotiating and debating with him is that, what is it I have left behind? Have I gone with all the values and all the knowledge that I had? Or can I say that I have replicated myself? So for me, if I can replicate myself and get others who are a lot better than me and who grow to go further than I have gone, then for me, that would be success.
Thank you so much for that. And I hope we get more successful people by the virtue that you've replicated yourself in them and they're making a difference in the world as we move along. And thank you for sharing your experience and your life journey with us. I hope we learn from it and get better as we move along the journey. So, asante sana, Dr.
Asante pia. Thank you.